Bolus feeding provides a relatively large volume over 10 to 20 minutes, 4 to 6 times per day, either by syringe or by gravity bag. Bolus feedings are used for gastric feeding, and with children who have some experience with tube feeding. Children who are bolus fed may have symptoms of GI intolerance, abdominal pain, cramping, nausea, and vomiting if the feeding is administered too quickly. Bolus feedings can be delivered through a syringe. You can also use the plunger in the syringe to gently push formula into the tube. Follow these steps. Use the plunger of the syringe to draw the formula from the measuring cup into the syringe. Place the syringe tip into the feeding tube. Push the formula into the feeding tube slowly and gently until gone, about 10 to 20 minutes. If your child's healthcare professional has told you to take extra water after feedings, use the plunger of the syringe to draw the prescribed amount into the syringe. Push the water into the feeding tube slowly and gently to flush the tube. You can also use the syringe to deliver bolus feedings by gravity. Remove the plunger from the barrel of a syringe. Place the syringe tip into the feeding tube. Hold the syringe above your child's stomach. Pour the measured amount of formula into the syringe. Open the clamp. Slow the flow by lowering the syringe, or speed the flow by raising the syringe. Allow the formula to flow slowly into the feeding tube until gone. Ask your child's healthcare professional to provide you with the amount of time it should take to infuse the formula. If your child's healthcare professional has told you to take extra water after feedings, pour the prescribed amount into the syringe. Allow the water to flow into the feeding tube until gone to flush the tube. In another form of bolus feeding, the gravity feeding container is suspended above your child, and the formula flows down through your child's tube. The flow is controlled by a clamp on the feeding set that allows formula to slowly drip into the feeding tube. Follow these steps. Hang the filled feeding container about 2 feet above and to the side of your child's feeding tube. Remove the cover from the end of the feeding set. Prime the feeding set and close the clamp. Insert the tip of the feeding set into the feeding tube. Slowly open the clamp on the tubing. Use the clamp to control the flow. Set the flow to the gravity drip rate written on your child's care plan. Make the flow faster by opening the clamp. Make the flow slower by tightening the clamp. When the feeding is complete, close the clamp. If your child's healthcare professional has told you to take extra water after feedings, pour the prescribed amount into the container. Open the clamp and let the water drip in until gone. After each gravity feeding, flush the feeding tube as recommended by your child's healthcare professional. Close the cap on the feeding tube until the next feeding.